Hello friends, welcome to my channel. Today's topic again is hemoptysis. Friends, earlier I have made few videos on hemoptysis, how to examine a patient with hemoptysis, how to take the history of the patient. Today's topic is little different, how to evaluate a patient with hemoptysis, or you can say how to approach a patient who has come with the symptom of hemoptysis or coughing out of blood. Friends, whenever patient comes to outpatient department to a doctor with this complaint of hemoptysis or coughing out of blood, we have to examine the patient, we have to take the detailed history of the patient and then investigations. So there should be a systematic approach, and if we do if you don't take the history, if we don't examine the patient properly, in a systematic manner, just random history taking or random examination or some investigations here and there won't do any good to the patient. We have to approach the patient in a systematic manner, in a proper direction, with a proper plan and vision, so that after the history taking, examination and investigation, we can reach to a specific diagnosis. It is easy to treat a patient when there is a specific diagnosis. If there is no diagnosis, then it's difficult to exactly control the bleeding, or you can say control the hemoptysis. So today's topic is how to evaluate a patient with hemoptysis. Let's start, friends. Friends, first thing we do is history taking. Though this history taking is necessary for any type of symptom, any type of patient, in case of hemoptysis, how to take the history, what are the things we have to ask from the patient, I have already discussed in my earlier videos. We have to know the detailed complaint of the patient, then history of presenting illness, past history, medical history, surgical history, any drug history, intake of drugs, occupational history, and history of smoking. All these histories are important. Then physical examination, then also general examination, then examination of all the systems, especially cardiac and lungs. So this thing we have to do with the patient. Then by this time you finish history taking and physical examination, you will definitely have a provisional diagnosis or thought in the mind that what can be the diagnosis. So after physical examination and history taking, two things we have to keep in mind, that we have to decide whether it is hemoptysis or hematemesis. Some patients won't give proper history, or sometimes they just tell that the blood is coming through mouth. I don't know whether it is coming from lungs or stomach, and it's very natural also. They might not know. So from the history taking and from the physical examination, we have to decide whether it is hemoptysis or hematemesis. If it is hematemesis, vomiting of blood, then it's not our job. We can refer the patient to a general physician. Regarding hematemesis and hemoptysis, the difference between two, I have already made a video, you can go through that. Okay, so next come to hemoptysis. If it is hemoptysis, then it's our job. Now we have to evaluate the patient. Three things can be there, three possibilities are there. First one is, it is fake hemoptysis or spurious hemoptysis. That also I have made a video, you can go through that. What is spurious hemoptysis? So first is, it can be spurious hemoptysis. Second is, this hemoptysis can be due to non-respiratory cause. Third is, this hemoptysis can be due to respiratory cause. Now, being chest physician or respiratory physician, we will handle the last one. The hemoptysis due to respiratory cause. But still, because all the patients with hemoptysis come to chest OPD, we have to know few things about other causes also. So if it is spurious hemoptysis, the patient should be referred to a ENT surgeon or a dental surgeon. We can examine the patient's mouth cavity and denture on this, and by examining also we can just diagnose some cases of ENT causes of hemoptysis, or if you are not sure, if you are confused, we can send a patient to ENT surgeon or dental surgeon. So spurious hemoptysis is done. Next is non-respiratory cause. In case of non-respiratory cause, mostly the causes are cardiac or hematological. So according to that, we have to investigate the patient. Cardiac causes, we can do echo, ECG, and if any problem is there, we can refer the patient to general physician, or we can evaluate further. Or in hematological condition, we can do blood investigation, some lab tests to diagnose any hematological condition. The third one is respiratory cause. So in respiratory cause, if there are multiple causes of hemoptysis, we have to do few investigation to do the exact diagnosis, to reach to the correct diagnosis. First of all, we do chest X-ray PA view. This is must. After you see the chest X-ray PA view with every detail of chest X-ray PA view, then three possibilities are there. First of all, the chest X-ray PA view can be normal. Second, there can be mass lesion or any opacity which is suspected to be mass. Third is other parenchymal disease. There can be consolidation, there can be some alveolar opacities, or there can be increased bronchovascular markings, or and so on. So three possibilities are there in chest X-ray. If it is normal, then we suspect maybe lower respiratory tract infection. In that condition, we advise antibiotics, bed rest, some sedatives, or any cough suppressants. So lower respiratory tract infection we can manage well. If in that normal X-ray itself, patient's condition or patient history is suspected, that patient might have some cancer or risk of cancer. If this is a smoker with long history of smoking, then other things like anemia, loss of weight, loss of appetite. If we suspect that the patient might have cancer or there is risk of cancer, then we evaluate the patient further. If there is no risk of cancer, then we leave the patient as it is and the bleeding stops, so no worries. If there is risk of cancer, then we ask for CT scan thorax or FOB, fiber optic bronchoscopy. So these are the thing when we find a normal X-ray. Here, any patient who had lower respiratory tract infection or risk of no risk of cancer, and after the evaluation, after the bed rest and sedatives and antibiotics also, patient bleeding is not stopped. I mean, patient continues to have hemoptysis and recurrence of hemoptysis, then of course we do CT scan and if needed bronchoscopy. So up to this level I have discussed about normal chest X-ray. Now come to mass. If there is a mass or suspected opacity which can be mass or cancer, then we go for contrast enhanced CT scan of thorax, and after that we can do bronchoscopy to take biopsy or bronchial wash or any TBNA. We can do bronchoscopy to confirm the diagnosis of mass. And if in chest X-ray there are other parenchymal disease or parenchymal lesions, then we ask for high resolution CT scan of thorax. After doing this, there are two possibilities. Either there is a specific diagnosis in HRCT, or there is no diagnosis. If there is specific diagnosis, then to reach that diagnosis or to support the diagnosis, or if there is suspected any suspected lesion or any suspected parenchymal disease, then according to that we can do other investigation, other lab tests to reach the diagnosis or to confirm the diagnosis. And in HRCT, if there is no diagnosis or no definitive suspicion of diagnosis, then we can again do fiber optic bronchoscopy to reach to a diagnosis, to take bronchial lavage or bronchial wash, or if any lesion is there, we can take biopsy also. So these are the algorithm to evaluate a patient with hemoptysis. This should be the approach, a systematic approach. Like if you do randomly some investigation, like whenever patient comes to outpatient department, we just ask for chest X-ray, sputum examination, then CT scan thorax. At a time we write all the investigations without doing physical examination, without taking history. Then it's a burden to the patient. Patient has to do investigation. Patient has to pay for that. And we don't have any particular plan in our mind that after this investigation report comes, what exactly we are going to do. So there should be a plan, and I think this should be the plan of the treatment or the investigation of this type of patient who present with hemoptysis in outpatient department or to a private clinic. Friends, that's all for today. Thank you for watching this video.